Going back to the what's it called? The cardiovascular system. I wanted to talk about a little bit why our heart is shaped the way it is and the way everything kind of works. So I've mentioned already that blood is going to flow in from the superior inferior vena cava into the right atrium. 70 to 80% of that blood is going to be passively leaked into the right ventricle. The rest of it is then going to be contracted through. That contraction is going to come from depolarizations from the SA node, which then hits the AV node. That AV node causes a delay. That delay allows time for that passive filling into the ventricles. The right ventricle then contracts into the right, or the right atrium then contracts into the right ventricle. That depolarization signal then travels down the middle of the heart, which is going to be the bundle branches. And then it's going to hit the Purkinje fibers at the bottom, at the apex of the heart. And then it's going to do a bottom to top contraction, squeezing until we gain more pressure in the right ventricle. Then we do the pulmonary artery. That blood is then going to go to the pulmonary artery, into the lungs. It's going to pick up oxygen, drop off CO2, flow back through the pulmonary veins into the left atrium. That whole cycle repeats until that left ventricle has more pressure than the aorta. When it comes to that pressure for the aorta compared to the pressure from the right ventricle to the pulmonary artery, it's going to be greater, which is why there is more muscle mass on the left side of the heart and why it's shaped differently, or why it's shaped not symmetrically. Because we need more muscle mass on the left side of the heart, because we need we need a stronger contraction, because the aorta has a lot more back pressure. The aorta is going to come, or it has that more back pressure because of the afterload, which is going to come from cardiac output equation, which I'll do in another video. So the more myosin actin cross bridges we have on the left side of the heart makes it a lot easier for us to squeeze and get that blood from the left ventricle to the aorta out to the rest of the body without having to increase blood pressure or anything like that.